Welcome to the Point of No Return podcast, an exploration of strategy, leadership, technology, and entrepreneurship. Your host, Nectar, is the co-founder and partner at the PNR, a strategy consulting firm based in Montreal.
Hey everyone, welcome to the Point of No Return podcast, a show where you interview industry leaders, presidents, and CEOs to better understand how they think about strategy. On today's show, I spoke with Martin Enault, Chief Operating Officer at Felix Paul Studios, as well as Chairman for Revivre. Today's a special episode airing on Wednesday, January 29th, which is Bell Let's Talk Day. Also in French, Belle Cause pour la cause. And Martin, as we get into it, is a chairman of an organization called Revivre, which is a nonprofit whose mission is to help those living with anxiety, depression, or bipolar disorders. And it works in collaboration with a public and community-based mental health networks. It's a organization that I deeply care about. It's a cause I care about. And Martin is a leader that obviously is contributing immensely to this field, not just in raising funds, but also in raising awareness. So we get into it a little bit today in terms of some of the taboos about mental health, some of the issues around how people still sometimes negatively react to these issues, but also how people can get help. And that's, I think, the important aspect of today's conversation. We do talk a little bit about tech and Felix Paul Studios and the things that they're doing in virtual reality as well. But the crux of the conversation really focuses on Revivre and the amazing work that they're doing there. Martin is a longtime friend and someone that I truly admire, and I think that you'll really enjoy today's episode. Thank you. So Martin, I guess the first place I'd like to start in our conversation is, how'd you get interested in the world of entertainment?
By accident, initially. I started my career in IT, and very quickly I started having music venues as clients, and it was a world that was interesting me because technology for me was a little bit too much routine and too much doing the same things. And I realized that entertainment would enable me to do different things every day and without never getting bored of what I was doing.
Yeah, it's we could talk about your track record in your past, because it seems like you've had this very squiggly career in terms of all the different zones, and there's so many different areas that I want to poke with you. And one of them is entertainment, and talk about maybe a little bit about your time at C2. So maybe a question I've never asked you is, how did you get the job at C2?
A friend of mine was a headhunter, worked with C2, and we were having lunch, and I was telling him, after selling my last company, Intellytics, I wasn't sure what I was going to do next, and he kept talking to me about C2, and now I should go and meet them. So I went and met them a couple of times, and we clicked, and I started doing some work part-time, and within a few months decided to join full-time and invest in the business.
Yeah. How early was it?
That was in 2013, so after the second edition of C2 Montreal, before C2 International existed.
Okay, so still very early days.
Yeah.
So it hadn't really achieved the kind of critical mass that it has today.
No, exactly.
And what do you think were the key takeaways from your time there? You obviously spent, I think, 4 years?
It's 5 years at C2. I mean, the key takeaways was seeing how quickly the world adapted to innovation and creativity. When I started, at the beginning of the 5 years, when I was talking to business leaders about the need to be creative and innovative, they would always react like it was just buzzwords and not necessarily necessary. And within a couple of years, people went from talking about it as buzzwords to actually considering it key parts of their business.
Yeah. And, it's funny because it's like, obviously it was, one of the driving forces behind it was Sid Lee. That is at a creative agency, and it feels like you really hit upon the right time of being able to basically what C2 stands for, right? Commerce and creativity. It's kind of like a merge of two very, very important concepts. And given that, I feel like the word's kind of disconnected, right? You give it on the one end, you have like super analytical, machine driven types of businesses, and the other side you need to have creative skills, essentially what the computers are not good at. And you guys really kind of focused on that, and it seemed to be, at least when I've been to every single C2 since its inception, it always really felt like the most creative and immersive conferences that I had ever been to. So in that vein, was it by design or by accident?
It was definitely both. more so by design than by accident, but a lot of great creative ideas often come by accident. We also had the opportunity to do quite a few events internationally for major brands like EY, Michelin, and Google, and Microsoft, and others, in which we tried various new ideas as well. So when we came back to C2 Montreal in May, we often had done 5, 6, 7 other events throughout the years that enabled us to try new things, see how people reacted, and refine them for the May event.
Yeah. And without maybe sharing too many secrets, what's the scale of C2 when you left? Like, how many people, or like any public metrics that you can share?
When I left, the company was about 150 employees between C2 Montreal, which is a non-for-profit, and C2 International. That's the for-profit doing the international events. The overall scale of the business, well, you can talk precise numbers. It's a private company, but we're doing approximately 15 major events a year at that point.
Wow. Yeah, that's pretty big. Knowing the Montreal one, it's not a small operation.
Definitely.
Yeah. And that led you to Felix and Paul, right? Which is one of the leaders in the VR space. So maybe the first question is, what exactly is Felix and Paul Studios?
Felix and Paul Studios is a VR entertainment studio. So the studio specializes in creating cutting edge content for VR and AR, and nowadays for any interactive platforms. And the studio was created by Felix Paul and Stéphane. They were filmmakers in the past and working as directors and producers in the film industry. And they thought that there was a better way to use technology to immerse the audience into content. So the company nowadays has about 65 employees and won 2 Emmys and was nominated 5 times for Emmys as well. Worked with President Obama, President Clinton, LeBron James, and many, many others. And we're currently actually filming in the International Space Station a documentary about life in space.
It's not too many companies you can say, yeah, we've worked with a few presidents and we're in space now.
It's definitely
it's pretty wild.
Yeah.
Was it a big leap for you? Because in the sense of, like, you're working obviously at C2, which has become kind of like a global phenomenon at this point, but now working in virtual reality, which on paper seems very different. So curious as to what are the similarities and what drove you to be interested by this new challenge?
Well, on paper it's very different, but I produce exhibitions in the past, I produce live shows, I worked in ticketing, I work in access control and such. A lot of what I did was always a mesh between technology and entertainment, and I've actually been playing in VR for many, many years. So what I'm doing, Felix and Paul, is actually a mesh of many of my past companies and past work I've done assembled together. And there definitely are pieces and parts that I've been learning in the last year and a half since I've been with them. But the overall concept, like when you're doing a location-based installation for VR, is very similar in doing live shows or live exhibits and such. So a lot of pieces are very similar.
Yeah. And it seems that VR as an industry is still in very early days, and obviously Felix and Paul Studios was an earlier precocious entrant into that space, but obviously having quite a bit of success. What are your thoughts about VR? Like, how early are we versus the potential?
I think that we're probably 3 to 4 years away from having mainstream adoption for VR. The industry is 6, 7 years old at this point from this current generation, because there was previous attempts of bringing VR even in the 90s and 2000s. This is the first time that there's consumer-friendly devices. The adoption of 5G will definitely play a big role in VR and AR coming to fruition. I do believe both of them are also combined to the same headsets eventually, and that the glasses will look like prescription glasses you wear today, and 5G will be a major part of that. So as 5G is just starting to roll out, I do think it's going to be a few more years before it becomes mainstream. Yeah,
it's one of those things. If you've ever tried, the VR headset, you're like, wow, this thing is going to change the world, but like not quite yet.
Exactly.
So I feel that Felix and Paul Studios' approach makes sense, right? Like to create a bigger scale, bigger impact, more immersive type experience versus, the VR on your smartphone. We're quite a ways away from that happening.
Exactly. And the content we've been doing, we have 25 projects right now that have been published. And those projects are all going to be relevant in 3-4 years. We have the right masters and the right technology to bring them to the right resolution when the technology is out there. So every project we're doing now is relevant now, but will also be relevant when it's the mainstream. And remember that whenever someone buys a new VR headset, they're like a new client. So a content that's 5-year old, when they see it for the first time, it's like a brand new content for them.
Yeah. Any thoughts on the whole AR, VR debate? Like, I know it's like two sides of the same coin, but do you guys dabble in AR as well? Or?
We do dabble in AR as well. We have one project that we're working on right now in collaboration with Magic Leap and Lippens & Company, in that I can't disclose too many details on yet, but will be an immersive storytelling platform using AR and books.
Okay, yeah, you piqued my interest when you said Magic Leap, like, we're the most secretive, interesting company that is either, like, based on what you're reading, is not my opinion, but based on what you read online, it's like the most fantastic invention or a complete fraud. Like, you have no idea, but it seems that they're doing some really cool work. If you look at some of the demos they put out, like, it seems very, very interesting. So curious to see what they come up with. And yeah, it's cool that you guys are partnering with them, right? Because they're well-capitalized, big backers in that company. So something must be going on. And the main subject I think I wanted to discuss with you, Martin, was something you've been also doing on the side, president of a small nonprofit called Revive, which I believe you guys are also rebranding this year. So maybe as the first question is, what is Revive exactly?
Revive is an association that was created 29 years ago to support people suffering from depression, anxiety, and bipolar disease. Through those 28 years, the organization definitely changed a lot. If you looked at it 15 years ago, most services were either support groups that were free of charge for people to come in and a line that you could call into. Just in the last 10 years, we've done over 15,000 hours of research in creating programs, training programs to help people take control of their mental health. So instead of them trying to get support from other people without really knowing what they're suffering from, actually educate people to know the symptoms, but mostly how to actually get better when it comes to anxiety, depression, and bipolar disease.
Yeah, and it's an organization, I think, that, and a subject that's been gaining a lot of attention. And you personally have been in the media, like just in, like, I think Q4 of last year, were, very outspoken, got a lot of press talking about mental health. Do you still think that the subject of mental health is stigmatized, or you think that now society more broadly, it's more accepted that, hey, this is just like any other, health condition?
Mental health is definitely less stigmatized than it was 10, 15 years ago. I've been involved for 10 years and I've definitely seen a big improvement, but unfortunately we're still years and years away from it actually being accepted as a normal health condition. First of all, in the public health system in Quebec, it's very, very poorly funded compared to traditional health care. So if you do suffer from mental health, you have very little chances of getting support that you need from the medical world. And if you go outside of Canada, many countries still don't accept to even consider mental health as a condition. So we're still a long way from global adoption of mental health as something that we all live with.
Yeah. And is it just because it's still seen as taboo? Like, what, it's culturally speaking, still in certain spheres seen as like, we shouldn't talk about this as a subject. You think, is that predominantly the reason why? Or is it a question of like, people just don't understand the, depression and anxiety as well as, let's say what cancer does?
I mean, it's a mix of all of those, and also the fact that the symptoms of mental health are ones that people are not necessarily willing to speak about publicly. I mean, if you break your arm and you show up with a cast at the office the next day, no one's going to say anything else than what happened. If you show up at the office with suicidal thoughts, you're not going to go to your boss and say, "Oh, last night I had suicidal thoughts and I'd like to talk to you about it." Like, it's a very personal subject that are not the kind of subject you normally open about publicly. So that doesn't help in breaking the stigma.
Yeah. And you've also been very public about your own personal, depression, anxiety, and how you've battled through it. So you see it, through that lens as well. So you're able to kind of like obviously have a deeper empathy, but also try and, how should I say, relate to people at that level. What do you think for you personally has helped you overcome, your own condition?
Well, the work of Revive is honestly what helped me a lot because it taught me how I could take care of myself instead of waiting for other people to take care of me. It taught me how to eat better, how to control my panic attacks, how to control my depression and anxiety, see the early signs and understand how to actually deal with those early signs. So before getting a full-on panic attacks, I'm able to know a day or two ahead that it's coming on, so I can actually do something about it to avoid getting a full-on panic attack. So knowing myself better and having tricks to take care of myself better has definitely helped me a lot.
Yeah. And, I think we were talking about before recording, right? Like, people in my entourage, friends, family have all been impacted by mental health issues. And I wonder if I'm guessing it's probably a large portion of the population that's in the same boat. But people just don't speak out about it. What do you think is necessary? Is there a lack of funding right now in terms of like getting more proper treatment, getting people to basically come out and ask for help? What do you think is necessary?
There's a lack of funding for sure. There's a lack of services that are well trained to take care of people, and the stigmas are preventing people from even wanting to ask for help. It's hard for people to understand what to do when someone suffers from depression and anxiety, and understand that it's not something that will just disappear from one day to the other. It's actually something that once you suffer from, you have to deal with the rest of your life. Not that you're going to suffer the rest of your life, but the consequences and the understanding of yourself that you develop will follow you for the rest of your life. So people need to deal with that very differently than having a common cold or a broken arm.
Yeah. And you've also been helping to spread the word and help particular organizations and their employees and their staff benefit from services, like you said, right? So funding and services. So curious to hear you about how you've been at the forefront of helping companies.
Well, I've been talking with executives for many years that investing in humans, so not just in mental health, but just understanding the well-being of humans in their business, will have an incredibly high ROI for themselves and their business, for employee retention, for recruitment, for their insurance costs, for the costs that it causes when people are not in the office for weeks or months at a time, and the fact that someone leaving in burnout costs a lot of money to a business, and the likelihood of them going back into burnout multiple times is an incredibly high cost for the business. So by actually, first of all, addressing the issue internally, and by executive talking to your employee openly about mental health, you start systemizing it in a way that brings much more value to yourself. And when you start actually listening to employees instead of just forcing them down a path or expecting that your employee support program or your insurance company will just solve the problem, you actually start seeing significant increase in your profit very, very quickly.
Yeah, it seems like the good approach, right? Like the best way for a business to say, hey, this is important, we should incorporate this in terms of our employee benefits and our program is, man, what's the ROI? Like you said, right? There's a definite return, because I see it, my wife works in the public healthcare sector. And it's a super intense job, right? Like think of like a nurse in a intensive care setting. There's a very high incidence of burnouts and depression that doesn't really get recorded in the public domain, right? You don't hear about it.
You definitely don't.
And there's not a proper support system for these people. Even though they're working in the healthcare system, they're not properly taken care of. At least that's what I've seen. So if organization, be it a profit or non-profit or public company, like a public sector, like a hospital, can offer better services, well, it just makes sense, because then you have less employee downtime. They're obviously going to be much more effective at their job, right? So from the pure cold capitalist perspective, it definitely makes sense. What do you think is going to be the natural evolution, right? As organizations, leaders start realizing, hey, this is just like any other aspect we need to incorporate into our, let's say, our corporate governance. What do you think is going to be the natural evolution for companies, or something that you would like to see?
I think, unfortunately, the natural evolution, and from my perspective, the amount of people suffering from mental health has gone on significantly in the past few years. There's more and more people.
An increase, you mean?
An increase, yeah. There's more and more people either being honest about it, but I personally think that's the fact that we live in an environment where performance is at the paramount of everything we do professionally. And when you have kids at home and a job where you work 50, 60 hours a week, plus all of the family activities and managing your budget and such, it's next to impossible to keep yourself stable. You're always going to have phases where anxiety and depression will hit you strongly, and society is just getting tougher and tougher for people. So I think companies won't have a choice but to address it, because as more and more of their employees become sick and ill and burned out, fortunately will be required for them to deal with it. And by unfortunately, I mean, it's unfortunate that we have to wait for it to become this bad for people to start dealing with it, because we've known for years and years this was coming. And now we're at a point where, as I'm speaking to executives, pretty much everyone nowadays tell me how it is a very important issue for them, because they deal with it on a daily basis in their business. Yeah,
I'm curious about you mentioned the increase. And I'm wondering, I'm guessing it's a bit too early to have proper academic research on this subject, right? Because you mentioned there's, the cause and effect is not clear. Like, it could be just people being, like you said, there's less of a stigma. So people are self-reporting at a higher rate. But it could also, and I believe also, just a higher incidence in the sector, right? So I see it from my world of things like social media and digital, how should I say, digital isolation playing a role. So I'd be curious to get your point of view, if you have any research or your thoughts on the subject, actually.
Yeah, I mean, I think it depends on sector. If we're looking at entrepreneurs, the BDC did a very interesting survey on mental health, and I think it was released 6 months ago, and it's still very, very relevant, in which they've interviewed entrepreneurs across Canada to get a full picture of entrepreneurs. One of the incredible finding is that 62% of entrepreneurs said that they feel depressed at least once a week. If you look at the numbers from the World Health Organization, they claim that about 30% of the world population will suffer from depression at some point in their life, which is already incredibly high and considered to be epidemic numbers. But when you're looking at sectors, specifically, if entrepreneurs suffer from depression once a week, 62% of them, it means that everyone's affected, because if it's not you, it's your wife or husband or friends or employees around you that will be suffering. And I'm not saying that 60% of the population. I think entrepreneurs definitely have a higher rate. But like you said, maybe nurses or public workers may be in the same numbers, but we are still too early to get full numbers. But every survey that's been coming back for the last couple of years, the numbers are going up significantly.
Yeah. And I'm guessing, the people that are entrepreneurs, that lead businesses, are also probably the group that will likely self-report less, right? Because they just see it as part of the job, that you have to suffer through the pain because I'm building a company or building an organization.
Yeah, you're supposed to be Superman when you're an entrepreneur. You're supposed to have no emotions related to financial stress, to whatever situation you're dealing with your employees, contracts lost and such. You're supposed to be strong and happy in front of your investors and reporting miracle solutions at all time. So it's definitely not in the nature of entrepreneurs to say, hey, I actually do feel depressed every week.
Yeah. It's I'd be curious to see any stats on this. Actually, see people that run, or organizations that have high stress and how they cope with it. Do you have any recommendations for entrepreneurs that haven't come out, that are feeling this pain but don't know what's the first step?
The first step is speaking up, even if it's just to friends or other entrepreneurs. What they'll realize is that they're not alone. I have yet to meet entrepreneurs that never have felt this way. Being an entrepreneur myself for many years, I know I've had some of my lowest lows because of business issues. But at the end of the day, at that point, I was not willing to talk about it because I was convinced that if I did, investors would stop backing me and that it would have a very negative effect to my business. The reality is, since I've been speaking out about mental health, is that profoundly more positive effects on me than negative effects. And everyone I speak to in the same situation says the same thing. It's definitely much more positive to come out and speak up about it than keep it to yourself.
Yeah, since you got a lot of mainstream press, have people reached out to you? Like, have you had a lot of entrepreneurs or executives talk to you? Hey, like, thanks for for what you wrote. I actually have been suffering depression, etc.
Yeah, for sure, hundreds of people, and even just looking at Revive numbers, there's a significant increase of people calling the organization from that coverage. But myself personally, I daily get messages on social media or email or text message from people talking about it.
Yeah. What's next for Revive? Like, where do you want to take the organization?
Right now, we're building programs for businesses because I've been saying for years that it's not just for governments anymore to take care of people's mental health. And I do believe that businesses have a role to play. You can't burn people out within work hours and let the government fix them outside of work hours. So we are building programs right now in which employers can give tools and access to proper education to their employees on what to do about anxiety, what to do about depression, what to do about general distress, and how can you get help. And it's not about just treating them, it's about giving proper education. No one knows what to avoid food-wise when they feel depressed or anxious. No one knows the real effect of exercise on their brain and what actually, well, some people do, but I mean, it's not widespread knowledge. So we try to bring out knowledge that is scientifically backed to people where they can actually help themselves be healthier.
Yeah. Yeah, it's fantastic work you guys are doing there. We're trying to support as much as I can.
And you've been amazing supporter, so thank you.
Well, yeah, it's small things. I think trying to help because, like you said, it's it's small steps, right? I think there's like one global solution to this issue, but maybe to zoom out and talk about any macro level solutions, right? So like if we look at we speak about the impact technology and like how a few years, VR's, coming out is going to be a few years away. What do you think are any long-term potential solutions to mental health that will have broad applicability, right? Be it, let's say, better brain scans that are able to identify and be preventative. So like more science fiction stuff, but maybe stuff that you've been interested about that you're seeing that has this potential to help ease mental health issues.
Well, I believe technology will definitely bring a lot of answers because right now we truthfully don't understand much about the human brain, let alone what happens when you feel depressed or anxious. We understand some synapses going off and such, and which part of the brain are more affected and such, but reality is everyone's mental health is unique. You may be a little bit bipolar, be a bit ADA. You may have different conditions that are all adding up to your own mental health, and we don't really understand that right now. So I do hope that technology will bring more solutions for that, in which we understand better what is happening in the human brain and the human body related to mental health. I do think VR is actually going to be very powerful because from what I've seen, proper good content in virtual reality, when people feel fully immersed, it's a very easy way to rewire the human brain and make people realize things that they would not realize in real life. I do believe it's a very powerful tool, both for good and evil. You could use VR to trick people in being more racist or trick them in being less racist. In the same way, I think you can help them being less anxious or more anxious. So it's a very powerful tool that I hope will be used for good in the future. But as the technology evolves, I do think it will play a big part in helping people with mental health issues.
Yeah. What are your thoughts on mindfulness? Is it like overhyped or underhyped in terms of helping with mental health?
I think it's good for some people and not so good for others. I think everyone needs to take the time to understand what's good for them and not try to find a miracle solution. What I don't like when I hear people talk about mindfulness sometimes is that it's the miracle solution and that it will solve all your problems. I do think it's an important part of it. I do think you should at least understand it better and read up on it and see what applies and what doesn't apply to yourself and try it out. But I don't believe it's the be-all solution for mental health.
Yeah. like I've dabbled in it. I've been getting better at it, and I do find it does help my mental state. But like you said, it's context specific, right? Each person will react to a different sensory input. So Martin, maybe final question. I can go on for a while, but I respect your time. What can people find out more about yourself? And also maybe a question about what can people do if they want to take like that first step?
Well, you can find out about me definitely on LinkedIn. I do post often and do post articles. So look up Martin Enault, Enault on LinkedIn, and definitely happy to connect with anyone wanting to chat. About Revive, if you go on revivre.org, you can find a lot more information about mental health. And Felix and Paul Studios website is felixandpaul.com. So definitely follow our projects and our upcoming projects in the International Space Station. And my advice to anyone wanting to take this first step in mental health is talk to someone about it. And if you have no one to talk to, reach out to me, and I'm always happy to exchange.
Yeah, great. That was amazing, Martin. Thank you so much.
Thank you. Have a great day.
Thank you for listening to the Point of No Return podcast. Don't miss an episode by subscribing on iTunes or Google Play.